A lot of people that have type 2 diabetes are not losing the lbs like they want to on this med. I'm going to explain that. A lot of people assume that if they have type 2 diabetes, they are going to lose a lot of weight, especially with this. And that's just not always the case. It can be, but it's not always the case, especially if you have type 2 diabetes. And some real-world studies have shown that responses can vary actually quite a bit, with a small portion of people seeing blood sugar and weight changes happen at the same time. These medications mimic a hormone that helps regulate blood sugar, slows down digestion, decreases those hunger signals that you feel in the brain. These weight-related changes, they don't happen in isolation. They're not immediate either. There are multiple factors of how someone can experience things with this med. The first one is other medications, especially when it affects your insulin levels. It changes how your body is handling glucose and energy, and different dosing approaches depend on what your goal is. Now, if you have type 2 diabetes, it's probably not up to you. It's probably up to your provider because they're the one that's monitoring your A1C. Of course, there's individual factors such as how long you've had diabetes and what your metabolism is like. So your daily habits affect overall intake and movement. Weight loss doesn't happen the way people expect it to or on a timeline. It's multifactorial. A lot of factors go into this. I'm Liz, and as a health educator, I make science a little more simple so you can understand how these meds are working inside your body, why someone's results can look completely different. So what can you do? What can help? You talk about your overall plan with your healthcare professional, someone that you trust. Of course, you have to focus on consistent habits of nutrition and of movement. Look at trends over time rather than a number. That's super important. And I don't know about you, but for me, I actually prefer non-scale victories than a number. My biggest non-scale victory, just for me, this is personal, I don't pull on the back of my shirts anymore. I had the back boobs, and I always had to go through my dresser, figure out which shirt was going to show them less that day. I'm so grateful. I don't have to do that anymore. Still, I've been on it for a year and a half, and I was going for a walk yesterday with my family, and I was like, oh my gosh, I don't have to pull on my shirt. That is my number one, other than my joint pain, that is the number one non-scale victory that I absolutely adore. I don't think about the number. I think about that victory. So look at trends. Don't just look at a number. And then, of course, you have to give your body time to adapt. Progress is not just about weight. Small changes over time can support your overall health in meaningful ways. So if you want science explained in a way that actually makes sense, follow along. Don't forget to share this with someone that has diabetes if they're frustrated on the med.